We know some things about it, but I think there's still a lot of open questions about what leads to blood-brain barrier dysfunction during disease. And there's some diseases where there's massive dysfunction, like a stroke and multiple sclerosis. There's other diseases, such as Alzheimer's disease, where there is dysfunction, but it's in very specific areas of the blood-brain barrier. And so really understanding how this happens is really important. And so it can happen in two ways. One is it can happen with a loss of a maintenance signal. So work done by my group and others have shown that Wnt signaling is very important to regulate the blood-brain barrier. And it's thought that maybe loss of this signal is important for blood-brain barrier leakage during disease. But it can also be signaled from breakdown signals, so signals such as VEGF or chemokines or cytokines can signal the breakdown. And so really there's a lot of work that needs to be done trying to understand what are the causes that in each of these diseases, and if we stop them, can we stop the pathophysiology of the diseases.